praise the Lord. Good evening, everybody. We're so excited, elated, actually filled with euphoria. And I'm standing on tiptoe anticipation about tonight. I'm so humble, feel so blessed to be able to have this roundtable tonight with physicians. It's Black History Month. And man, look at all these wonderful African-American doctors that are practicing and helping people every day. So what a privilege, honor, and a great joy it is for me to be hosting this platform tonight. And I know that a lot of people have a lot of questions. We've gone through now a year and a half or so of this virus, and so many people sick from it. People got questions about the vaccine. And so I'm here tonight, and hopefully we have the doctors here that can answer some of the questions that a lot of people are asking. A lot of people are asking me about the vaccine. And I've told people, look, I don't have an answer. You know what? But we got some medical professions, and we're going to allow them to answer some of these questions. So good evening, everybody. Good evening. Good evening. Good evening to all of you. Do me a favor. You just watching at home. Go ahead and share the broadcast. We're going to go ahead and our panel tonight. And my phone may be breaking up just a little bit. I apologize for that. But we're going to go ahead and introduce our doctors tonight. We're going to allow them to come back and tell you exactly what they do and who they are. We have Dr. Etta with us, of course. Thank you, Dr. Etta. We also have Dr. Bukola Etta, his wife, with us tonight. We're excited to have her as well. We also have Dr. Anakwa here as well. God bless you. Glad to have you with us tonight, Dr. Anakwa, and also Dr. Belinda Graham, Gadsden's own, homegrown. Thank you, Dr. Graham, for being with us tonight. We also have another Gadsden native, Dr. Jasmine Hurd. God bless you, Dr. Hurd. So glad to have you with us tonight. And also from Atlanta, Dr. Brooks. All right. So we're excited to have you with us. I know you all are busy. Again, I want to say how thankful I am for all of you in the medical field, out on the front line, doing what you do to help people to get well. I said earlier, I'll say it again, you are the real MVPs. And I want to say on behalf of all of us watching, thank you. One of the reasons why I have this roundtable is because I think when people see people that look like them, they have a tendency to listen to what they have to say. With so much CNN and so much news and so much online, but when you have African-American doctors, people that look like you, giving you advice, I think that speaks volumes. So good evening. Welcome once again tonight. We're going to start with Dr. Etta, and we want him to just come. Basically, Dr. Etta, if you will, just basically tell us who you are and explain to us what a nephrologist is and actually what they do.
Hi, good evening, everyone. My name is Etta. I'm a kidney doctor. My practice is here in Gadsden. As a kidney doctor, I'm primarily an internist, and I take care of people with kidney disease. Most people in my practice are, I would say, middle age to elderly with some form of kidney disease, and people with severe hypertension that have not been controlled on their current medications. I also take care of people on dialysis and people who have had kidney transplants.
Bukola, will you just come and basically tell for those who maybe don't know what an anesthesiologist is and what they do?
Good evening, everyone. Can you hear me? Good evening. I'm Dr. Bukola Etta. I'm one of the anesthesia doctors here in Gadsden. And we help to get patients ready before surgery. I take care of patients before surgery, during surgery, and also after surgery. And we also help with pain management. For example, we put in epidurals for pregnant women that are in labor and delivery. As well as chronic pain management, people that have low back pain issues, we can do epidurals for them as well. And we're also critical care doctors. We manage a lot of the airway and help patients to prepare for surgery, change medications, make sure that diabetes, hypertension, and their medical comorbidities are optimized so that they can have a smooth surgery and recovery afterwards.
Thank you, Dr. Etta. Thank you. And also, Dr. Anaqua, would you just explain to the people that what an oncologist, hematologist is, and basically what it is that you do?
Good evening. My practice here is in Gadsden, Alabama as well. I specialize in adult cancers, as well as I specialize in disorders of the blood. And that ranges from anything from iron deficiency anemia, disorder of platelets, people with blood clots, as well as cancers of the blood, such as leukemia and lymphomas.
Thank you, Dr. Anaqua. Dr. Belinda Graham, I never heard of an immunologist. So can you explain to us exactly what that is and tell us a little bit what an immunologist is and what they do?
Okay, so good evening. My name is Belinda Graham, and I am an allergy, asthma, immunology specialist right outside of Atlanta, Georgia, and Smyrna, Georgia. And I see both children and adults. I deal with disorders ranging from allergic rhinitis to allergic conjunctivitis, which is just allergies of the eyes and of the nose. I know a lot of you guys have seasonal allergies, so you're familiar with that. We also do eczema, food allergies, and of course, asthma. A lot of people may not know what an immunologist does. Immunologists, they deal with people that have immune systems that don't function properly. And for that reason, they're more prone to infections such as sinusitis or recurrent sinus infections, recurrent bronchitis, recurrent pneumonias, recurrent skin infections. So we see all these types of people and we treat them so that they are not prone to getting infections in the future.
Thank you, Dr. Graham. Thank you. Also, Dr. Jasmine Hurd, family medicine physician. Can you tell us a little bit about what you do, Dr. Jasmine?
Sure. Good evening, everyone. So I am a family medicine physician, and I currently work in a rural setting where not a lot of people have access to care. So in family medicine, we usually say that we see people of all ages. So that's from, newborns, so 0 to 100 and beyond. And currently I work in both the outpatient or clinic setting and also inpatient or the hospital setting.
Thank you, Dr. Jasmine Hurd. Dr. Herschel Brooks, pharmacist. Evening. Tell us a little bit about what exactly it is that you do in medicine, Dr. Brooks.
I work for Piedmont Healthcare, which is a system here in Atlanta. It has about 11 hospitals. And basically what I do is I work with a team of providers such as physical therapists, respiratory therapists, social workers, and of course the attending physicians. And we create care plans for patients that are in the hospital for whatever, they're in the hospital for. We make sure, that the patient, we work in a team because we feel that the patient, of course, needs more than just medicine to get optimum healing. And so we create, the medicinal and the social and the respiratory plan for patients in our hospital.
Amen. Thank you, Dr. Brooks. Thank you. All right. Well, listen, we're about to get to really the good part because so many people are asking me about this vaccine, which I currently have not had either shot. This Pfizer, Moderna, now Johnson & Johnson rolling out. So in the same order, if you've had both shots, can you tell us about that? If you've only had one, let us know. But what I really want to know is, and I think the people watching, when it comes to this vaccine, so many people have questions, especially in the African-American community. They are so skeptical about the vaccine and have so many questions about it. And so I'm hoping tonight that they can see people with some black and brown skin that look like them that can maybe convince them to let them know that it's maybe okay to take the vaccine. So we'll start again with Dr. Etta. Can you tell us about your experience? Dr. Etta's one of my doctors as well. Tell us about your experience with the vaccine, any side effects that you may have had, just so our viewers will be able to hear that, know that, and be able to document that.
So I got the Moderna vaccine. I believe I got my second dose sometime in December. And I think the background to that was when the pandemic started initially, I had COVID, I believe sometime in the early parts of the pandemic. And then I recovered with very minimal symptoms. I got the first vaccine, I had minimal symptoms. The second vaccine, I did feel tired for about a day, 24 hours, and then it resolved. I believe the symptoms or the fatigue I had after the second vaccine was consistent with what was reported in the trials when the vaccine was given to about 23,000 people. It was mild fatigue. It was nothing that was able to get me out of work. I was able to walk during that period. Yeah, so I've gotten both vaccines and very minimal symptoms. I would say many of my patients have had no symptoms, and there's been some anecdotal evidence that people who have gotten COVID in the past tend to have more fatigue with the second vaccine, but I did pretty well.
Thank you. So if people start to feel fatigue, there's really no reason to panic. If they start having some of these side effects, there's really no reason for them to panic after the vaccine.
That's correct. Yeah.
Thank you, Dr. Etta. Okay, Dr. Bukola, same question. The vaccine, any side effects that you may have had, or any symptoms you may have had that people watching who may have questions or still skeptical about it, maybe still afraid, how was your experience with the vaccine?
So I got the Moderna vaccine as well. And with the first shot of the vaccine, I just had a little bit of swelling at the injection site, and my arm was sore for, I would say, about 2 to 3 days. Now, with the second shot, I also had a lot of fatigue with that. Thankfully, we didn't have fever, didn't have any chills. So it was mainly the fatigue, and the fatigue that I had after the second dose of the vaccine actually started about 20 hours after I had the second dose of the vaccine. Now, I have had co-workers, some doctors that have had fever, they've experienced fever, chills, and the fatigue after the second dose of the vaccine, which I've seen enough where they had to call out of work and just to take a day off to kind of recover from it. Nothing extreme or alarming, just low-grade fever, chills, and fatigue with the second dose of the Moderna vaccine.
Great, awesome. Thank you, Dr. Etta. Also, Dr. Anakwa, your experience with the vaccine, any side effects, symptoms you may have had, can you share those with us for our viewing audience, please?
Absolutely. So I also had the Moderna. I had a lot of arm soreness at the injection site. I mean, it was pretty intense. I mean, I literally felt like I was kicked by a bull. And I could barely pick up my toddler, but it only lasted for about 24 hours. I didn't have any fatigue, chills. With the second vaccine, the soreness was not as intense. I had a little bit of fatigue, but I worked the entire day, the entire weekend, and so I was perfectly fine. My husband also got the vaccine, and he did have he had more symptoms after the first vaccine. He had some chills, some low-grade fatigue, and literally had to go to bed early. But by the time he woke up in the morning, I mean, it was like nothing ever happened. And then with the second vaccine, he didn't have any problems at all. So that was my experience.
Awesome. Okay. So we're hearing some people have symptoms and other people don't. So really, I guess each person that goes in for the vaccine having totally different experience, but hopefully our audience will feel more comfortable when their turn rolls around. Okay, Dr. Belinda Graham, tell us about your experience with the vaccine. Any symptoms, side effects?
So I received the Pfizer vaccine, the first one in December, and I received the second one January the 9th. With the first injection, I had mild discomfort at the injection site. I had my injection about 7 p.m. in the evening after work. I was fine. The next day, I noticed a headache that lasted midday, maybe till midday, but I worked that day and I was able to get through the day, but I did kind of have a low grade nagging headache. And looking back on it, I did have some fatigue. And the soreness of the arm, as others have mentioned, maybe last 1 to 3 days, a few days, nothing major. With the second vaccination, I had actually deliberately made sure I got my vaccine on Saturday, just in case I would have symptoms, and I did not have any other than I had some mild swelling at the injection site that lasted a few days. So I actually did better with the second vaccination. A lot of my colleagues and patients, most of them did fine. A few of them did have symptoms, as others have mentioned, muscle aches, some headache, fatigue, fever. But I will say, in speaking to a lot of people, if they did have these symptoms, most of those symptoms resolved within 24 to 48 hours, and did not require them to have to go to like the ER, urgent care, or anything serious like that. And most of them have no regrets, even if they did become a little bit ill. But I had no complications that were significant with the second vaccine or the first.
Awesome. Thank you. Thank you. Dr. Jasmine Hurd, can you tell us about your experience? I appreciate all your transparency. This means a lot to everybody that's watching, I can assure you.
Sure. So I received the Pfizer vaccine with my first dose in December. I really didn't have like severe side effects, as some of the other physicians are saying. I did have some soreness at the injection site that I would say was a little bit more, intense versus some of the other vaccines that we routinely get. For example, the flu shot. But it didn't last more than 2 or 3 days. I took Tylenol, which helped. And similarly with the second vaccine dose, just some soreness at the injection site. So no fever or fatigue or anything like that.
Awesome. Thank you. Thank you so much. Dr. Herschel Brooks, your experience with the vaccine.
Else, because I have elected as of right now not to get the vaccine.
Okay.
I knew that there were, some others in the pipeline, and just kind of wanted to wait to see. Being in the hospital setting, as all of you are, I was seeing, probably the end of summer, how there were different mutations coming along and things. And I'm just like, oh, no, I think I'm going to wait it out. Just to see if there was going to be a vaccine that I felt was probably going to be maybe broader coverage, maybe, just kind of waiting a bit, not just jumping on or taking, I should say, the first vaccine. I knew there were some others, and I kind of wanted to weigh my options of the other vaccines that were coming out before opting for the Moderna or the Pfizer. So I haven't made the line yet. Mm-hmm.
Thank you. Thank you so much for your honesty. Thank you for your transparency. I know people that are out there watching that maybe feel the same way. And so that's what we want, a diversity here. So thank you so very much for sharing, Dr. Brooks. Okay, Doctor, back to Dr. Etta. With the 3 vaccines, or the 2 that's most people are taking, Pfizer, Moderna, I'm hearing so much now that one is increasing their dosage or their strength and all of that. Is Dr. Etta, is there, if people were on the fence right now, I'm hearing a lot of these questions. I'm not qualified to answer them, but you guys are. If people are on the fence about which vaccine to take, what advice do you feel like you could give them out of the three that's available, the two that's available, and the one that's on the way right now, what advice would you give them?
So I'm going to speak about Moderna and Pfizer. I don't know a lot about the Johnson & Johnson vaccine, but I'll say as far as Moderna and Pfizer, I believe they both have equal efficacy in terms of preventing COVID-19. So I don't know clinically if there's one choice of one over the other. I think it ultimately comes down to the availability in your local community. I know there's been a lot of talk about Pfizer being stored in requiring very cold temperatures that we may not have in many communities. I think they applied to the FDA for approval on that today. They are saying that the vaccine can be stored in a freezer now, as opposed to the sub-zero temperatures. But I think ultimately it boils down to what you'll have in your community. I personally don't think one is superior to the other.
Okay, thank you. All right, Dr. Bukola. I think I'm gonna give you two questions, Dr. Etta, if you don't mind here. There's so many people that's skeptical about being put to sleep right now, especially during COVID. So we're just trying, I guess, to ease some of the fears that people may have that are faced with the surgery that they maybe need to have or they have to have. Is there any problem or any fear that people should have for upcoming surgery while we're still in this pandemic right now? We know the numbers are coming down. We're seeing it on the news every day, but I know we're not out of the woods yet. So can you speak to that as far as people who are needing surgery that are just afraid to be put to sleep right now?
Sure. I think when we first had the pandemic with the spike, initially last summer, a lot of hospitals shut down. And part of that was not having enough hospital staff, hospital employees getting sick, including anesthesia providers and surgeons. And we've kind of had that experience too over the winter during December and the January spike in the COVID-19 cases. And so many hospitals reduced the number of elective surgeries that we were doing. And at a point, depending on the number and how prevalent, how many COVID-19 cases numbers we're actually doing only emergency cases at some point. And so the healthcare providers working with the hospital, depending on what the numbers are showing and how much staff we have in the hospital, how much bed availability we have in the hospital, we have been changing what we do as to whether we do elective surgeries or we do emergency surgeries only, or we do both. And so I just want people to know that even before coming to the hospital, our patient safety is our priority. And we're looking at the numbers every day. We're looking at bed availability, how prevalent COVID-19 disease is in the community. So I would say it would be kind of a personal choice, talking to your surgeon. And okay. A lot of anesthesiologists too, we have pre-surgery clinic where you can come to the anesthesiologist clinic and talk to the anesthesia providers about the type of surgery you're having. There are some surgeries that can be delayed depending on the urgency of the surgery. Now that the COVID numbers are coming down, we are doing more elective surgeries than we were doing in the past, I would say around December, early January. And we're taking all the safety precautions and measures that we need to take in terms of wearing masks, hand washing, social distancing, putting patients to sleep. We know that and another complication with that is that in the thick of the pandemic was patients couldn't have loved ones come with them into the hospital to be with them before surgery, during surgery, and kind of afterwards too, to give them that social support. And we are aware of that too. And so we would not put anybody to sleep if we didn't think it was safe or that the surgery was necessary. So I think it was a discussion that each individual will have to have with the surgeon. And also, you can also ask to see the anesthesia provider before surgery to talk about your specific fears and if the surgery can be delayed or if it's something that needs to be done right away.
Great. Okay. Thank you. So I think you answered my other question right there. So thank you very much. So I hope that helps those who are facing surgery. A lot of it has to do with what type of surgery people are having to have. So thank you very much again. So we'll go to Dr. Anaqua on this next question, who is my hematologist, oncologist. Matter of fact, Dr. Anaqua, I think the last 2 weeks, I've had 1, 2, 3, 4, 5 doctor visits, did blood work 5 times in the last 2 weeks. And so with people who are cancer patients, Dr. Anaqua, and who are having to go through chemo, should they have any fear? What effect is COVID having on those patients or people like me with pre-existing conditions who are having to come in for treatments? And some of them, like I was supposed to have this week, sometimes it's long treatment, 6 hours, 7 hours treatment. So what effect is COVID having on patients with pre-existing conditions?
So basically, cancer patients who are on active treatment, those patients, the ones that actually develop COVID, first of all, those patients are more likely to become very, very sick. And that's from a number of reasons, from their cancer, from the active treatment that they're getting. And the ones that develop COVID that are sick are more likely to be hospitalized and also are more likely to die. Patients that are on high doses of immunosuppressive therapies like steroids, or patients who have disorders of their immune system. For example, there's a type of chronic leukemia called CLL that I treat, where there is a disorder of the lymphocytes which produce the antibodies. And those patients, when they develop COVID, they just don't have the immune system to fight COVID effectively. And patients who are actually on active treatment and patients who are not even on treatment are still more likely to die of COVID. And so COVID has really, really impacted cancer patients. But I can tell you that from a cancer center standpoint, we have been extremely cautious with our patient population, trying to do everything to try to minimize their COVID exposure, just by coming to the center. Where the first thing we did is that, of course, we initiated the mask mandate. We closed our lobby down. We had to limit visitors that can come in, as well as we just take very special precautions and try to minimize the amount of patients that are coming to the office. So only patients, especially at the beginning of the pandemic, patients that were, coming for iron deficiency anemia, things that were mild or things that could wait, we pushed it out. Patients who were 2-3 years out from their cancer diagnosis, we pushed them out, to try to minimize that exposure. And so far we've been very lucky. Temperature checks and everything. So everything we can do to try to minimize exposure to patients with all the pre-existing conditions of cancer and immunosuppression.
Okay, thank you. Thank you, Dr. Anaqua. We appreciate it. Listen, we got a lot of questions coming in from the audience. So either doctor can answer these. I want to ask this to Dr. Jasmine Hurd, if you don't mind. So why should people get the vaccine? Now, Dr. Jasmine, your organization actually gives the vaccine. Is that correct?
That is correct. So I'm definitely a proponent of the vaccine. And I think it is just human nature for everyone to kind of have that fear of the unknown. But, just from my personal perspective, just having, been on the front line for almost a year now and just kind of seeing the toll that COVID has taken on so many families and so many communities. I think you just have to do, some thinking about it and go to whatever process that you, make those decisions for yourself. But you have to look at the risk versus the benefits. And for me personally, the benefits definitely outweigh the risk. And so, yes, my organization is administering the vaccine. I am a part of the Cahaba Medical Care Group. And we have several locations in Jefferson, Bibb, and Perry County. So, if you're looking for information on the vaccine, your local health department is always a great place to start. Another resource is definitely your primary care office, to see if they are actually giving vaccines. We're still kind of in that first wave where we are, giving the vaccine to those patients that are over the age of 75, frontline workers, EMS professionals, firefighters, also those that work in long-term care facilities such as nursing homes, and also those nursing home residents are getting vaccinated as well. And in some counties, we're actually opening up vaccine slots for people that may not be 75 but have certain high risk health conditions such as renal failure or kidney disease or COPD and lung disease, diabetes, or any immunocompromising conditions such as HIV or sickle cell. So definitely, start with those resources, the health department, and also your primary care office, to figure out kind of where your community is with distributing those vaccines if you're interested in that.
Thank you. Another question that just came in, since your organization is administering the vaccine, Dr. Jasmine, would you recommend, or do you see people in this age category, should an 89-year-old get the vaccine shot?
So definitely this, pandemic has affected our elderly population at an alarming rate. So I think, in primary care and in medicine, we're always talking about shared decision making. So I think for that, 89-year-old person, it would be best to kind of sit down and have a conversation with their primary care provider, talk about all of their health conditions, and just kind of go over that risk benefit conversation to see if they should be vaccinated. But ultimately, if they do make that choice and they don't have any history of, say, allergic reactions to, vaccines or any of the vaccine components, I think that in a lot of cases for our elderly, those benefits do outweigh those risks.
Thank you. Thank you very much. This is some really great information. Thank you all so much for sharing. Dr. Graham, now being an immunologist and an allergist, I'm assuming the patient that you see, they already have breathing problems, correct?
Yes.
So is there any extra precaution for the people or the patients that you see now that we're in COVID? So if somebody's watching this and they have, I was just talking to somebody earlier today, and they were talking about their asthma or their breathing device that they use. Is there any extra added precaution that they should be taking, being that we're in COVID now?
So I see primarily patients with asthma, but I do have some patients that have asthma that overlap with COPD. And of course, they need to be taking the precautions that all of us are taking: the hand washing, the social distancing, avoiding large crowds, wearing a mask. So definitely all that stuff. And they're probably doing those things anyway. But as far as extra things, the single most important thing you can do if you have an underlying respiratory disease such as asthma or COPD is take your medication. I know it sounds like a simple request, but if your doctor has asked you to take a daily medication to prevent asthma exacerbations in the future, that is something very important, because asthma is inflammation of the lungs, and you want to have a good lung function at baseline. So if you do get COVID, you're not adding fuel to the fire here. So please take your medicine, do the things that your doctors are telling you to do so that your asthma can be well controlled, or COPD, or whatever respiratory disease you have. Be compliant and make sure your asthma is stable. And if you're not stable on the regimen, that that they've given you, notify them and let them know, hey, I'm using my rescue inhaler multiple times a week. I'm waking up at night with symptoms. Let them know, hey, my asthma is not controlled. We need to do something different. And in addition to that, if your asthma is not controlled, this is not the time to be going to urgent care in the ER unnecessarily, because now you're putting yourself at risk of being around other people that have COVID. So that's another reason why you want to definitely try to keep things at bay, because you don't want to put yourself in an environment where you could get it from somewhere else.
Awesome. Great. Thank you. Thank you so very much. Great information. Thank you so much. Dr. Brooks, I've noticed, and my wife was at a conversation, seemed like a couple of weeks ago, they're claiming to have a miracle pill online that cures COVID in 3 or 4 days. Now, I need you to speak to that. Have the CDC come out with something like this? When my wife was sharing it with me, I was in another room, and she was saying, baby, they got a pill now that'll cure COVID in a couple of days. And even though I had not looked at it, I had not seen the information, I said, you telling me the CDC have approved something like that? I said, read the fine print. And so she kept reading, and so she couldn't find that. But can you speak to that for people who, some people believe everything they see online? That is there anything out there that you know of that is anything outside of the norm of the precaution that we're taking with masking and washing and taking care of ourselves that are not COVID out in 2 or 3 days as a pharmacist?
Well, I think I've seen that same advertisement, and I think I chuckled just as hard. No, there's nothing that that's out there that's going to cure COVID. There's nothing out there that's going to absolutely prevent COVID. We have, as we talked about, the vaccines that help. We talk about the hand washing. We talk about wearing the mask, the social distancing, and things like that. Those things help, but nothing is absolute. So if we can do those things, that helps. There have been, we use the regimens of zinc and other vitamins, vitamin C, zinc, and it's another one I can't think of the top of my head, but we use those kind of as prevent measures, but nothing that the CDC or the FDA has approved. There's been some talk about some other things like ivermectin that you can use to kind of prevent or kind of help with COVID. There's been nothing. Again, there's only one approved drug, absolutely approved by the FDA for COVID, and that's remdesivir, and that's an actual medication, antiviral that you take in the inpatient setting. But everything else is either an emergency use or just a trial or just some thoughts that we know or some uses that we know that have been beneficial in other respiratory diseases and illnesses. And so, that's what we, use to help with COVID and to help our patients. And absolutely no miracle cure, one pill, 3 days, you're going to be completely healed. No, nothing like that.
Okay, got another question for you. While we're on that, I worked almost 25 years at FedEx. And so with all this going on, I called a couple of guys this week because I was hearing about all this mail being held to find out, are we going to run out of medicine? Is there a shortage of medicine? Being in this pandemic, with more people using medicine, more people, a higher demand for it, is there any reason to fear of a shortage of medicine? I talked to the guys I used to work with. They say, yes, Memphis is shut down. The warehouse is shut down. We're not moving, not even the vaccine right now. But is there any fear in general of us running out of meds during this pandemic?
Speak at my hospital, I can't say that there is a fear, but I can say that there's a concern. We have run out of things, have been unable to get certain things, sterile water and in certain kind of vials, and maybe not so much the medication part that we are that's limiting us, but maybe the actual vials that they come in or the rubber stoppers. There's some, because so many things are produced and manufactured outside of our country, that we've had some challenges in getting some medications. Dexamethasone has been a shortage for us. Hydralazine, which is what we use for, high blood pressure. So things like that. Insulin has been short for us. The type that we use, the brand that we use for our particular hospital. So again, I don't think that there's any real concern that, you know, absolutely, but I should say that there's a fear that we'd run out, but there have been some, you know, we've had some challenges getting it to our hospital and getting in the right doses. A lot of, you know, when patients were, a lot of patients during the summer on ventilators and things like that, we were having difficulty getting propofol and other sedatives that we use when for ventilation management for patients. So there's been some shortages. The shortages are real, but you know, in a day or 3-4 days or so, we normally are able to get them. So they're there. They've been challenging, but I think that, you know, we're going to be able to, you know, to work through them. But they have been, you know, there are real concerns.
Thank you, Dr. Brooks. Thank you. I appreciate you all so very much. I just love all the doctors. I promise you, when you've been in the hospital as much as I have, you just learn to love and appreciate all of the doctors. Thank you. Here's another question from the audience. They want to know if is there any mechanism of the vaccine that alters the DNA? So I don't know who can speak to that. Is there any mechanism of the vaccine? Again, this is from the viewing audience. The numbers are still way up with people have questions. Is there any mechanism of the vaccine that alters the DNA? I need to know about that, I guess, if there's anybody that can speak to that.
I think I can answer that question.
Okay, Dr. Graham?
So the answer is no. You are not altering your personal DNA by getting the vaccine. And I think this is actually I'm about to answer, I think, my next question. Can I go ahead and answer?
Yes, yes.
Okay. So what happens when you get the vaccine? Or maybe we should have Dr. Brooks answer this, not me. But anyways, well, Dr. Brooks, we can tag team on this, okay?
Yes.
So what happens? This is an mRNA vaccine or a messenger RNA vaccine. So when we get the vaccine, this mRNA tells the cells, hey, we want to make this spike protein. And this spike protein is similar to a protein that the coronavirus has. So when our cells make this spike protein, our immune system sees it and it revs up and it establishes immune response to the spike proteins, and we produce antibodies so that when we're exposed to COVID in the future, we have these antibodies to protect us. So that's all it is. We are producing a protein that initiates an immune response. The immune response produces antibodies. The antibodies protect us against the virus. It is not altering our genetic makeup. It's not altering our DNA. Dr. Brooks, am I on it?
I can add anything to that.
Thank you. Thank you so much. This is a question coming all the way out of Huntsville, Alabama. So thank you for clarifying that. It's going to be great to come back and just look over this information again after it's over. So, Dr. Etta, we're hearing a lot about herd immunity. I don't have a clue what it is, you know, but if you can explain to us about what herd immunity is and why we need to establish that or reach that.
So, you know, I think that the concept of herd immunity comes from you expecting that if a large segment of the population is exposed to a disease, that many people would become immune such that the disease has nowhere to go to. So if, and I think the 2 times, smallpox for one, smallpox was eradicated to some extent because the large majority of the population got the vaccine. And then you have so many people who are already immune to the disease, either by getting the vaccine or by getting the infection and they did not die. And so the virus literally has nowhere to go to. I believe recently also the Zika outbreak in Brazil, that also came up somewhere there also. You had this huge virus, there was no treatment, there was no vaccine. So many people got exposed to it, and then to some extent, the virus just kind of dwindled away because the large majority of the population were exposed to it. And so in COVID parlance, you're expecting that if you can immunize a certain amount of the population, that the virus literally has nowhere to jump to and fro, and then the incidence or the number of people that get infected just keeps dwindling down, such that you can contain it clinically. With COVID, I think the problem we may have is one, when people do get the infection, we understand that it's rare to get a reinfection within 3 months, but what happens after 3 months, we don't know. So if herd immunity were going to come from having the infection, as far as COVID is concerned, we don't know what happens on month 4. Will the herd immunity persist on month 4, or will the virus suddenly have many more places to bounce to? But the whole idea of herd immunity is many people get exposed to an infection, and they either develop immunity from the infection itself or from vaccination, such that the virus has nowhere to go to.
Great. Thank you. Thank you. Thank you so much for answering that question. I appreciate that, Dr. Etta. Okay, Dr. Bukola. I've had six operations, and in the past, I've never had any problem with anesthesia. You may have already answered this question. Until my last surgery, when they removed my spleen, I was not able to wake up for some reason. And I didn't know what was going on. I was asleep, but I could hear people talking, and I panicked, almost just kind of freaked out a little bit. But, with the pandemic and with the fear of the virus and, with people being put to sleep, there's really no reason for them to actually fear being put to sleep. I think even if it wasn't the pandemic, because of my last experience, I've just got some kind of fear now where I've gone into surgeries in the past without even thinking about it. You just count a few numbers, and next thing you know, you're sleeping, you're waking up. So there's no reason for people to fear in this pandemic because of the anesthesia.
Yes. And so in terms of the pandemic and people having anesthesia for surgery, COVID doesn't have any impact or clinical significance on a healthy patient coming in for surgery as to if you're going to wake up from surgery or not. Now, we do take care of very sick patients in the hospital that already have COVID and they have other medical problems, and they're in the hospital recovering or getting treatment from COVID. Now, if you have COVID that is severe enough that you've been admitted to the hospital, that does impact your anesthesia care. And not so much as to whether you're going to wake up from anesthesia or not, but there's some safety measures and things that we change in how we provide the anesthesia. For example, we've noticed that if a patient has severe COVID and is admitted to the hospital, one of the best things that we can do for such patient is to avoid leaving the patient on the breathing machine. So if the patient needed surgery, for example, if a patient were in the hospital and it's a COVID patient that needs to get the appendix out, and they were having surgery, we will put you to sleep and we'll put you on the breathing machine, and we'll do everything that we can to make sure, more so because of COVID, that we get you off the breathing machine, because many severely ill patients with COVID do better if we can wean them off the breathing machine so that they're able to breathe on their own. For patients in the community that do not have COVID or don't have any symptoms of active COVID, coming to the hospital to have surgery, COVID doesn't really have a huge impact on us being able to wake you up from surgery or your ability to have surgery and your pre-op care. Now, I usually educate my patients that we have different types of anesthesia. And I think patients do get confused depending on the type of surgery you're having, on your medical comorbidities, that's medical problems that you have, would determine the type of anesthesia that we give you for the procedure. So for example, if you're having a colonoscopy or an upper endoscopy, which is 20 to 30 minutes, oftentimes we'll do sedation anesthesia where you're asleep, but you're still awake enough to breathe on your own. and to protect your airway. And oftentimes we don't have to put you on the breathing machine. And you can drift in and out of sleep with that. As opposed to if you're having like your appendix taken out, in that case, we do a general anesthesia where you're completely asleep. And I also educate my patients at the end of surgery, sometimes you will hear your anesthesia providers calling your name out, even if you're not 100% aware of what's going on, because we do want you to be awake enough for us to know that you'll be able to breathe on your own and protect your airway before we remove the breathing tube. And so I think sometimes a lot of confusion, patients will say, oh, you know, I was awake during surgery. And oftentimes when you talk to anesthesiologist about it, you come to find out it's towards the end of the surgery is done. We're waking you up and you're becoming aware of your environment and what's going on. And we do want you to hear us and to respond to us at the end of surgery, so we know that you'll be able to breathe on your way and stay awake after we've woken you up from surgery and anesthesia.
Okay, great. All right, thank you. You've restored my faith, and I hope I don't have to be put back to sleep in the name of Jesus no time soon, in Jesus' name. All right, thank you, Dr. Etta. Dr. Anaqua, why are we hearing so many people developing blood clots associated with COVID? And secondly, right now, is it safe to give blood right now?
So the first issue, so yes, so patients that are develop COVID who are sick enough to be hospitalized develop what we refer to as a hypercoagulable state, meaning that they are very prone to very serious blood clots. In fact, one study showed that in ICU patients, up to 43% of patients with COVID actually developed a blood clot of the lung, despite prophylactic measures. And the reasons are not exactly clear, but a lot of it has to do with just the severe pro-inflammatory state of just the COVID infection itself. To answer your second question, yes, it is safe and is actually strongly recommended that people still donate blood. There have not been any reported cases of COVID transmitted through the blood. It's virtually impossible. So it is strongly recommended that people still continue to donate blood.
Okay, thank you. Okay, Dr. Graham, you did such a great job with the question about the DNA. I think you touched on this basically some already, but I just want to ask for the skeptics out there saying, are they infecting me with something? Are they injecting me with something? When we get the vaccine or take the vaccine, are we being injected with the virus? Just for the viewing audience, because the numbers are just still going up. If you can answer that question for us. We can't hear you.
I'm sorry. I think I got muted accidentally. I guess I'll start over. I don't know how much you heard, but you're not getting infected with the vaccine. With the virus. You are not getting the virus when you get the vaccine. And what happens is when you get the vaccine, we are prompting an immune response so that when your body sees the virus in the future, you don't become ill. We're simply we're causing your body to produce antibodies so that you can be protected against coronavirus when exposed. But in no way are you getting the actual virus.
Awesome. Thank you. Dr. Jasmine, family medicine, that covers children and adults. Is that correct?
Yes, that is correct.
Dr. Jasmine. So what are we seeing as it relates to children, Dr. Jasmine, and the virus? And, I don't know why they carry it a whole lot more, but maybe don't get as sick. So what are we seeing as it relates to children?
Yeah, so we definitely know that children are being infected with COVID as well. And there's been this whole debate over the past year, should they be in school? Should they do virtual learning? So what we're seeing currently is that children, make up about less than 1% of all of the COVID deaths, which is low. But of course, any death in a child is significant. And we're seeing that about maybe 2% of children who get infected with COVID require hospitalization. In most cases, children have mild disease, with the fever, the aches, the respiratory symptoms. But we do know that we've seen children, unfortunately, with no previous medical history, get severe illness and require hospitalization. Of course, there are some conditions in children that would predispose them to having severe disease. Any condition that's going to weaken the immune system, such as sickle cell disease, or any lung disease, such as cystic fibrosis or asthma, is going to, give children a harder time with this disease. But hopefully, there are some new trials that are recently enrolling children to see if the COVID vaccine is going to be equally effective in children without those risks. So I think that hopefully over the next year, we'll be able to see the results of some of those trials. I know that Pfizer and Moderna initially enrolled clinical trials for children greater than the age of 16, and now they've broadened that to children 12 years and older. And then there's also some trials involving Oxford University in conjunction with AstraZeneca in the UK that they've recently announced that they're studying the vaccine in children ages 6 to 17. So I think that does give us some hope on the horizon as far as the vaccine being available for children. Of course, we're going to have to wait months to see what those results are. So maybe we'll be hearing something about those results in early or late summer. So I think the main thing is just kind of going back to those CDC guidelines, social distancing, wearing, making sure that they're wearing masks, that they're doing appropriate and effective hand washing. And, if they are doing virtual learning, and you have someone to be with them at home while you go and do some of those errands, your Walmart trips, and maybe it's just best for you to keep them home if you can at this time. But hopefully we'll have some good news from some of these vaccine companies, and that this vaccine will be shown to be both safe and effective for children.
Amen. I agree. Thank you, Dr. Jasmine. We appreciate that. Dr. Brooks, I have to take meds every single day. My doctor's on here. I want them to know I comply. I take my meds every day. But what if something happened? My mother is confined to the home. What if something happens and I can't get out? I need this medicine to make my blood coagulate, to make artificial platelets in my bone marrows. What if I can't get out to get the meds I need? Is there any kind of emergency number that I can call, or people that's watching? So many people in Texas right now, they're just really they're shut in. They can't get out and can't do anything, can't move. What does a person do if they're in a bad situation and they cannot go to the local pharmacy?
Really tough question. I'm thinking about the people in Texas right now. We used to live there, and it's just that's a really, really tough situation when you're not able to, and you have people around you that aren't able to as well. For them, I be honest, I wouldn't know what they would do when you're in a situation where, there's a storm and there's, no means of transportation of what, when you're limited and, you run out of your medication. I'm not really quite sure what you would do in that situation. Situation where, maybe, storms and things aren't the challenge, but just maybe you are just unable physically to get there. Or maybe possibly don't even have the means, the monetary means to be able to get the medication. There are a lot of drugstores will allow you. First of all, a lot of drugstores do have delivery service, so that is an option. If you aren't able to get it personally, then maybe a family member, can get it for you, or a neighbor or something like that. There are also most drugstores will allow for you to get emergency use of a medication for a couple of days or so, up until the time when, just say if your doctor's office was closed down for an emergency of some sort, they'll allow you to get a few doses, 3, 4, 5 doses, up until the time where the actual provider can provide a adequate prescription, for them, or to you. Those are normally, and financially, there's normally assistance. Oftentimes, medication, especially medications that haven't gone generic as of yet and are really, really expensive. And even some that are not, they do have care cards that you can oftentimes get from your actual provider. Even I know when you're sometime released from the hospital, the actual provider or social worker that's been assigned to you will provide these kind of coupon type, you get the first, 10, 12, doses for a minimum copay of $5 or $10 or $7 or so. With COVID, the thing about that is that normally, oftentimes when people have COVID and they're released, they're normally treated for respiratory or lung type, medications. Again, I talked about the fact that there's only one approved medication, IV medications that they get in a hospital. So anything normally when a person is discharged from the hospital, it's going to be maybe in other physicians on here on the panel can talk about it, but it's probably going to be an inhaler, which you can oftentimes get assistance for, or it's going to be something like one of the old drugs like the dexamethasones or the zinc, or the vitamin D's, or something like that are normally affordable. So that's the kind of advantage to the medications oftentimes that are used to treat, COVID, an outpatient COVID or any of the, respiratory diseases that come with COVID. That is kind of a godsend, if you will, that a lot of the medications for those are normally more affordable than some of the, higher medications or higher price medications that are, still that haven't gone generic yet. So I don't know if I answered your question, but those are some of the options that we have for those things.
Well, thank you so much, Dr. Brooks. Listen, we're right at an hour. The numbers are still up, but listen, I want to put this question on the floor. This comes from the viewing audience, and then I want to give everybody a chance to share maybe something that we didn't cover. The question from the audience is, if you have had COVID, how long should you wait to get the vaccine? Is there a time frame or time period? I don't know how that works. Say I've had it. I had COVID in January, which I did. How long should a person wait to get the vaccine, for anybody who wants to answer that question?
Okay, I guess I'll answer the question. So, but what I've understood, and my colleagues will help me with this. If you've had monoclonal antibodies or if you've had plasma in the past, when you had COVID, the recommendation is to wait 90 days before you get the vaccination. So monoclonal antibodies or plasma. Now, what they're saying, if you've had a prior infection, is kind of like, they don't say it has to be 90 days, but they're saying, okay, you've recently had COVID, they're allow other people to get the vaccine before you. It's kind of, from everything I've read, it's almost like saying, okay, yes, you may have an opportunity to get the vaccine, but allow others, since we know it's in high demand, to get consider letting others get the vaccine before you if you've already had it recently and you probably have some immunity to it. So they really don't say exactly, wait 1 week, 2 weeks, 3 months if you've had a prior infection. They're just saying, okay, if you still have some immunity, maybe allow others to go before you. But I have read that the 90 days is more specific for the monoclonal antibody and the plasma. Have any of my colleagues heard anything similar to this?
That, and At our facility, we say, for those that have had COVID, we say, wait till your symptoms have fully resolved, and then you can get your vaccine. So that's kind of, just kind of, play on words.
Yes, that was very important. Yes. You do not want to be actively still sick.
Exactly.
Everything I said, plus what she said, you want to be fully recovered from your most recent illness.
Somebody else some time to get it right. Yeah.
Thank you.
Thank you. I appreciate you answering that question. Anybody else that want to share on that? Listen, if not, we're right at an hour. I do want to give you space to any advice that you would like to share, any thought that you would like to share about the virus that maybe we didn't cover, or maybe for a question that didn't come in. If you would like to offer any other input as it relates to the virus, the vaccine, the vaccination, you can do that at this time.
I talked about earlier about how I have not gotten a vaccine, but I do want people to know that I strongly believe in vaccination. I believe that it's important. I believe that if you have any just one risk factor can kind of spiral you out of control and not know how this particular disease will play out in your body. So if you have, if there's anything, obesity, if there is high blood pressure, diabetes, sleep apnea, don't hesitate. I mean, run to get it as soon as you possibly can. And that's my recommendation. And I just wish everyone to be well.
And there's been a video going around of someone who got the vaccine and afterwards collapsed or had difficulty breathing and collapsed. And we know that people with severe allergies can have reactions to the vaccine. So if there's anyone out there thinking, hey, I've got real bad allergies, this could be a problem. I know in our facility, I don't know what it is in other places, but when you get the vaccine, you're kept in there for 30 minutes. And there's someone in there with an EpiPen. If you were to develop an allergic reaction, that will be taken care of right in there. I don't know if that's the same everywhere, but having that in of itself should not be a reason why you should say, I'm not going to take the vaccine. I think you should talk to your primary doctors and know that there is another option. There's always going to be someone in there with an EpiPen. You will be observed for at least 30 minutes.
And I like you brought up a very good point. I'd like to piggyback on that because I get this question every single day about allergies. So the American College of Allergy, Asthma, and Immunology, they put out a statement based on some things that took place in Europe or some vague statements that were made in Europe about allergies and the getting the vaccine. So their statement was, and this is pertaining to the Pfizer vaccine, that people that have food allergies, seasonal allergies, that they're no more at risk than the general population to have an allergic reaction or anaphylaxis to the COVID vaccination. Now, I'm not saying a person's not going to have a reaction. We don't know. I could have gotten a reaction. Some of the other doctors could have gotten a reaction, but they're just saying that their risk is not higher than a general population. However, there are people that have had reactions to vaccinations in the past. They may be allergic to some of the components in the vaccine. Polysorbate 80 is in some of the influenza vaccines. It's in COVID vaccines. PEG, polyethylene glycol. So if you've had prior reactions to some of these major components, that raises concern. You need to have a conversation with your physician and let them know, hey, I've had reactions to these components. I know it's in the COVID vaccine. What do I need to do? And if you had a severe reaction to the first vaccination, you need to pause and say, hey, we don't think you need to get the second vaccine because you had an allergic reaction to the first one. But I just want to make that distinction that it's really mainly if you have a known history of an allergic reaction to the components. Otherwise, we're all taking a gamble. We all have a risk. But if you have a peanut allergy, an egg allergy, if you're allergic to birch tree grasses, we don't think you're necessarily going to have a severe anaphylactic reaction.
Awesome.
And what I wanted to kind of piggyback on that also is it's actually a CDC recommendation that wherever you get the vaccine, you should be monitored 15 to 30 minutes
Yep.
after the vaccination. Because of course it's dangerous if you're having a reaction and you get behind the wheel and start driving and you get drowsy or dizzy or you have a reaction to the vaccine. So when people are planning on, taking time off work or how to kind of plan when they want to get the vaccine, you should plan having to wait 15 minutes, at least 15 minutes after you get the vaccine for you to be monitored at the vaccine site. And if you've had an allergic reaction previously, then plan to wait 30 minutes. That's the CDC recommendation. To wait 30 minutes after you get the vaccine to be monitored before you leave the vaccine site. And then I just want to encourage everybody, even if you've had only the first dose of the vaccine, or if you had both the first and the second dose of the vaccine, we need to continue to practice, the simple things of continuing to wear your mask, social distancing, washing your hands for at least a full 20 seconds, even if you've had the vaccine. And we do that really to protect others in the community that have multiple medical problems. They have a compromised immune system, like cancer patients that may not be able to easily fight off COVID. As somebody who doesn't have as many medical problems, or they've had both 2 doses of the vaccine. And so even though my husband we've had the vaccine, but we still wash our hands, wear a mask, practice social distancing. We need to continue to do those things.
Great. This is a wealth of information. Anybody else? Thank you so much. Listen, this has been wonderful. I mean, this is just a wealth of information that we've received tonight. Even now, at an hour and 15 minutes, the numbers are just still way up. So many people are being helped tonight. I'm being helped tonight. I want to just say thank you to all of you in the medical field. We love you. We're praying for you. We're lifting you up. You, again, are the real MVPs. I've said it 3 times tonight. I want to say to Dr. Etta, my own doctor, I'm glad that you're in Gadsden. I'm glad the Lord sent y'all all the way here. And you've certainly been a blessing to New Destiny. So thank you, Dr. Etta and Dr. Etta. Thank you, Dr. Anaqua. God bless you. My blood doctor and cancer doctor, I appreciate you for all that you do. Thank you so much. Dr. Graham, we really love you. Every time I'm in the hospital, my wife says, either Bridget, Dr. Graham texts me, called to check on you. So we appreciate all that you do. Dr. Jasmine, listen, we went to church together in the same home church for years when you was just a little girl. Now you're a doctor. I just talked to your dad earlier this week. And I know they're all so proud of you that's watching tonight, Lady Brenda and so many others that's watching right now. And Dr. Brooks, we appreciate you so very much. Friendship go back 20, 25 years now. So I just want to tell all of you, we appreciate you. We just want to get this information to the people. It's Black History Month. My babies are watching. And one of them told me they want to be a doctor. They said, Pops, I'm going to be watching tonight because I want to be a doctor and help take care of you one day. I said, well, praise the Lord. So thank you all so very much. If we don't have anything else, I do want you to send me your Cash App. Let Lady Rita and I at least buy lunch for you. Thank you so very much for your time. We know you're busy, but we're praying for you that God will continue to just keep you. And Lord, I just lift up every physician on here right now, every doctor on here right now. Pray that you will continue to watch over them and keep them safe, keep their families safe, God, while they're working. Some of them work around the clock. Many of them keep them safe, God, from this virus. Protect their homes. Continue to bless the works of their hands. And I want them to know that they are appreciated. I'm calling this Doctor's Appreciation Day. I want them to know that we appreciate all that they do in the medical field, being on the front line, putting their own lives at risk. I cover them this night. And we ask it all in the matchless name of Jesus. Amen. Amen.
Amen.
Thank you so very much. Thank you all. And again, you're the real MVPs. This has been very rich tonight. I can't wait to go back and watch it again. On behalf of Lady Rita and I, we love all of you all.
Thank you.
God bless you all. Take care. Have a good night.
Good night.
Good night.
Good night.
Bye.